Hi everyone, Dr. Scott Theirl, and you're here with my practice Functional Restoration. I'm excited to spend the next couple minutes with you discussing extremities and chiropractic care. What does that mean? It means how do we work with your shoulders all the way down to your fingers and your hips all the way down to your toes? So often people think we only work on the spine, and that's just not true. We are trained in differential diagnosis of all the various parts of your body and your musculoskeletal system, also all of your various systems. So come join me. We're going to fix my finger and we're going to talk about how to think about various extremity pains. Let's go. So let's go ahead and use my hand and fingers as an example of how to work on extremities. Last weekend, some of you know and others of you don't, we have a vintage RV. She is 26 years old as of this year, and she's a Class A holiday rambler. And I decided it was time for a little soundproofing on the RV. Now, soundproofing material is very sticky, and it has tape on one side and foil on the other, and it's designed to absorb vibration and sound. You put it around the engine cover, and you put it on the floor, and you can put it in the walls as well, which means you have to do a lot of bending, twisting, and moving of carpeting and other types of scenarios. Clean it, adhese it, put it back together. And I noticed the next day that my finger joints hurt a lot. And it was these particular two joints of my middle finger. And they were sore. But they were sore and achy, and they felt stiff even though I had full range of motion. And it wasn't that I could push on them horribly much and make a whole lot of pain. It was a little tender, but not much. So I said, what else is going on here? And again, if you're going to work on an extremity, you're going to think about everything that inserts here. So we're going to go up the flexors. We're going to poke around the hand and say, what do we got with our different flexor muscles that are short, our brevis muscles? What do we have with our flexor muscles that are longer? Do we feel anything down here? And you're going to see my fingers move as I'm poking around. That might actually be contributing, causing some tightness. And I didn't have a whole lot of tightness up here that was making these guys hurt. So then I flipped it over and I said, okay, we've got full range. The joint itself isn't super tender, but it aches, it feels stiff, it feels arthritic. That's how I would define it. It feels like an arthritic type of achy pain that just kind of stays with me all day long. It's worse when I use my hands a lot, but it does quiet down a little bit when I don't use them as much. So I come on my extensors and I start poking around, and you can find all of these wonderful diagrams on any type of anatomy book or on Google, and you can look at the muscles that extend your fingers, your digits, and find them and follow them and start to poke. And what I found was this guy right here has been tight all week, and it's time to loosen him. So what we're going to do is we're going to take a little bit of ultrasound, gel or lotion. We're going to use our ultrasound machine over here, which I already turned on. And we're going to turn up the power on it so that we're getting a little bit of power through there. And if we had this ultrasound machine in water, you would actually see that the sound head produces sound waves. It's kind of a fun trick to do because people say, well, I don't always feel it vibrating. And it's hard to feel vibrating because it's vibrating so very fast. The good news is that's what makes it really comfortable. It doesn't sit there and, hurt tissues in any way. It's just a gentle, very fast vibration that penetrates down into those soft tissues and really starts to loosen things. So I'm going to go ahead and do this for at least 5 minutes, maybe even 10. We'll see, depending upon how it starts to loosen up and what it feels like. And what you notice right away is when I push up here, guess what hurts? Those two joints in my middle finger hurt. But they also feel like they're starting to feel just better and looser. And so we're going to work on these forearm extensors for a couple minutes, and then I'll show you what I'm going to do next. Okay, so I just put away the ultrasound machine and shut that off. We're going to wipe off this ultrasound lotion that hasn't soaked in yet. And ultrasound lotion is primarily just water, a little aloe vera in there, very gentle on the skin. You need water, and that's why you need either lotion or gel to help those sound waves conduct into the soft tissues that you're working on. If it was over the skin and didn't have anything between it, you wouldn't be transmitting the sound waves through. You need something wet. Sometimes if you actually just strain a finger, say like a really bad jam with a basketball game, you'll put that hand in a bucket of water and use the ultrasound under the water to work those sound waves into that finger and work on that sprain or strain that's happening. So we'll go ahead and put our lotion away. We're going to come over here to our laser next. Now, cold lasers, depending upon the power, that decides really how much light you can put into the body at any one given session. So this particular laser only does anywhere between usually 1 and 3 minutes of light in any one region, and you're just not going to soak up a whole lot more or get a whole lot more benefit that way. So if you were to watch this, you can go ahead and you go right on those super tight areas and you just hold them there. It'll beep every 10 seconds or so, and then over the course of a minute, it'll actually shut itself off and you'll be in good shape that way. Then you can restart it again if you like. Now, with lasers, again, 1, 2, 3 minutes on a region, and then it's done. It's that quick. And then the neat thing is, in my experience, that deep tissue work, plus the ultrasound, plus the laser, that will continue to loosen and relax over the coming hours and days. Really, in my experience, over the next 2 to 3 days, people start to go, oh, it's so much nicer. So you get the immediate pain relief while they're in the office, and then you get the residual improvement over the next couple of days because that tissue continues to heal, heal, heal. Now again, I like this idea of putting some kinesio tape on here. So we're going to go ahead and put a piece of kinesio tape. We're going to follow the length of that extensor muscle. Now this is easier to do if you have 2 hands versus 1 like I do, but we'll just put it right on here. Start this paper peeling back. And again, because it's a sore muscle, I'm not looking to activate it more. I'm looking to get some extra relief to it. I want to open up the space there. So we're going to do about 25% of its maximum stretch. We're going to come right down, and we're just going to stick it on, push it down, pull that paper off. And that tape will stay on this forearm extensor that moves down to this middle finger easily for the next 1, 2, 3, 4 days. Patients that sometimes where we put it on the, if they're working on a shoulder, on their back, where they don't always rub it a lot, sometimes it stays on for a week. It's just amazing if you're working on a rotator cuff, right? Or just an area that doesn't get rubbed as much as, say, a forearm or a wrist or the foot, right? You can have tape stay on a forearm or the lower portion of a calf, and it stays on there for days. It's just wonderful. So here's the takeaway on all this stuff, guys. Know that there's a lot you can do to help with chronic joint pain. Know that anti-inflammatory diets are super important. Know that topical ointments can be beneficial. Know that if you start to experience joint pain that sticks around and feels arthritic and hasn't moved a whole lot, that you want someone who can examine not only the joint itself, but the ligaments surrounding that joint that hold the bones together, the tendons that actually insert into those ligaments and bones around there that move those joints, and you want someone to be able to follow those muscles up, in this case, all the way up here, to fix everything that's going on down here. This is the problem. This is the symptom. And that's the fun of working with extremities. They respond incredibly fast, in my experience. I mean, there's just, you work on it, you send you off for a couple of days, we see how it feels, and if it needs another round, away we go. So whether you're somebody who has a sports injury that just doesn't want to heal, whether you're somebody like me who was working on an old vehicle, or whether you're just somebody who had some bad luck and maybe tripped and fell and hurt your wrist or hurt your ankle or whatever it may be, know that chiropractors work on extremities, and I think it is a blast to help people get those extremities feeling really good as quick as possible. So, I'm Dr. Scott Theirl. Thank you for spending some time with me. Wherever you are, whether you are using your RV, right, and your vintage RV in our case, or whether you're at home and watching this, I'm wishing you your best brain, your best body, and your best life. I'm going to go use our RV this weekend. We've got a couple weeks of really nice weather coming up. So I'm going to get out there and do some hiking and biking myself with my family. Thank you so much for listening and tuning in. Take care. All right, everybody. Well, that is it for today. If you enjoyed this video, go ahead and smash the like button, hit the subscribe to our channel button, and the bell notification button so that you're notified when we release new videos on various topics. And while you're at it, be sure to check out some of our other videos on our YouTube site as well. They're filled with information on musculoskeletal care, various functional and integrative medicine topics, as well as neuro rehab. And with that, thank you for your time. I appreciate it greatly. Wishing you your very best body, your best brain, and your best life. Take care.